Welcome. My name is Peter Strong. I'm a professional online therapist. Offering online therapy is a way of helping you overcome your anxiety or depression or addiction, and it's much more convenient and much more comfortable for you. I really enjoy working with people over Skype. It's much more empowering than going to see a therapist in an office. This approach, I feel, is much more effective, especially if you're working with anxiety and particularly if you're struggling with agoraphobia. So, agoraphobia usually begins with a series of panic attacks, often appearing for no particular reason, but that are very distressing, very unpleasant. And what happens is that we tend to develop fear, reactive fear, to the reoccurrence of these panic attacks. And that fear then converts into avoidance. So we try to avoid any situation in which that panic attack may reoccur. So these patterns of avoidance tend to proliferate, and we start avoiding more and more things based on that fear. The problem is that avoidance fuels fear. So the more you become wrapped up in patterns of avoidance, the more fear you will experience, and then that leads to more avoidance behaviors. And so it sort of spirals out of control, and you become more and more limited and confined to a smaller and smaller space. Sometimes people are unable to leave their house. They're afraid of any kind of zone that's out of that immediate comfort zone of their house. So going to the grocery store, driving a car, even walking around the neighborhood may be way too challenging. And this is the result of this accumulation of avoidance and the fear that is fed by avoidance. So the first understanding we must have, if you want to beat agoraphobia, if you want to overcome agoraphobia, is that you must not accept these avoidance habits. Instead, we must turn that around and start facing each situation. But we have to do this in a strategic way, with lots of training, and that is what I find is usually lacking in classical exposure type therapy. It's not enough to just force your way through a traumatic situation. That will simply reinforce the fear. It will not resolve it. So exposure therapy, as it's usually taught, is basically going to be mostly ineffective. You cannot expect yourself to habituate to that situation simply by repeating it over and over again. That could also simply repeat the fear, the trauma over and over again. In many ways, agoraphobia is really a kind of post-traumatic stress disorder. It's that reaction to the trauma of the panic attacks that you had originally. So exposure therapy by itself is absolutely not enough. You must take a much more strategic approach. But it is, of course, a necessary part of your recovery. If you want to beat agoraphobia, you must undertake progressive exposures. We understand that. But how do you do that? That's the question. So in the mindfulness approach, what I call mindfulness-based exposure therapy, we will start by making a list of all of our challenges, those situations that we are currently avoiding. We turn that into a list, and we train with each one of those challenges on that list, and we do it thoroughly until we experience no anxiety whatsoever. The way that we train is the vital component here. This is what makes the difference. You must train in a very thorough way before you do any of those challenges, so that you can avoid that re-traumatization. So we train through a process called mindfulness meditation, and this basically is where you would meditate on the challenge before you do it. So you play that challenge through in your mind in detail, and you look very carefully for any fear reactions and any thought reactions that get triggered as you imagine going to the grocery store or whatever it may be. We want to get that reaction into consciousness. We want to see it consciously rather than have it operate unconsciously as a habit. That's the difference. So we bring consciousness to it, and that is mindfulness. The first aspect of mindfulness is developing a conscious relationship with your experience. So here we evoke the anxiety reaction, but on our terms and with consciousness, which is quite protective in many ways. We look at the anxiety, we develop a relationship with the anxiety, but as an observer. That is what consciousness allows. You can observe the anxiety or the thoughts without becoming identified with it, without becoming a prisoner of that thought or emotion. So when you're observing something, you are the observer, not the object that you're observing. So here we're learning to see the anxiety or those anxiety-producing thoughts as objects in the mind. And this is actually what they are and what they have always been. The anxiety is an object that gets triggered and arises in the mind, stays there for a while and then usually disappears. The problem is that we lose that perspective as observer, and we become identified with the emotion or the thought or the belief, whatever it may be. We become identified with the object, the mental object. When that happens, that also triggers fear. So it feeds the reactive fear that leads to more and more avoidance behaviors. So the first part of our training is to be able to sit with the fear and not identify with it, to stay as the observer. That is an immense achievement when you can get there. It's not that difficult. You just have to know what you are doing. You have to approach this with an understanding of the purpose of why you are imagining doing the challenge, why you're meditating on it. the purpose is to establish that new relationship of observer seeing the object, the emotion. That effectively separates you out from the emotion and stops that process of reactive identification, which is the major issue. Then, as we continue our meditation on that fear, we can begin to explore how it works, its structure. And the structure is made up of two primary parts. The first is the constellation of other emotions, other emotional reactions, and other thought reactions that become conglomerated into that fear. So we begin to see the component parts that make up the structure of that fear. That's very important because it's easier to change each little part than it is to try and change the whole thing. So we look at the thought structure and the emotional structure of the anxiety or fear that you're meditating on. Then we also look at another part of its structure which is immensely important, and that is the imagery of the emotion. The way that you see the emotion in the mind is what actually causes the emotion. So thoughts do not cause anxiety. It's actually the other way around. Anxiety causes anxiety-related thoughts, which then feed it. What causes anxiety is imagery. So we look at this imagery and we then explore how to help that imagery change. Because when the imagery changes, the emotion changes. So if you want your anxiety to diminish, you have to change the imagery of the anxiety. That is how emotions heal naturally in the mind. Their imagery will change over time. And in meditation, we're just speeding this process up. So this we call the response of compassion, which is a very important and vital part of mindfulness meditation. We respond to the anxiety that we have provoked in the mind, if you like, or invited into the mind. We respond to it with compassion, which is how can I help you heal? And that involves changing the emotional imagery, and it involves seeing the reactive cluster of thoughts and other emotions and working with them in the same way, changing their imagery and changing our identification with them. So this is what I call training. So we train in this way, teaching the fear to basically resolve itself, so that we can imagine going to the grocery store without any fear at all. Then is the time to try the exposure challenge. And then you go to the grocery store and you watch for any anxiety that may arise. Often you'll find that it will start to subside very much quicker than it would usually do. Why? Because you've done the training beforehand, so that training begins to take over automatically, and the anxiety begins to resolve itself in the grocery store if it ever gets triggered. But that's not all. So after the exposure challenge, we then repeat our meditation. This is called a review meditation. We review any anxiety that may have gotten triggered during that fresh exposure challenge. We work with it in exactly the same way, and we help it resolve. until we've felt that it is completely resolved and that we can reimagine the challenge that we just did without any anxiety. Then, after a brief rest period, we repeat the challenge again. We meditate before the challenge, we do the challenge, we meditate after the challenge. So this is a very strategic form of training, and it's because of that very focused quality of this work that it will work much more effectively. And people typically see quite remarkable changes when they apply mindfulness-based exposure therapy, often within a matter of weeks instead of years. This approach is very practical, very focused, and it's something that you can do, and that's very important. So I do not advocate treatment-based approaches, because that simply reinforces your identity as a victim, as an agoraphobic. That is not the way to go. I do not advocate medications, because that reinforces your identity as a victim. That is the problem. So it simply reinforces the fear. So if you'd like to learn more about this approach, then please contact me and we can discuss this further, and we can set up some online therapy sessions via Skype. The online therapy option, of course, is going to be very beneficial for you if you're suffering from agoraphobia. So most people see quite remarkable changes after practicing in this way, in this strategic way, after 3 or 4 weeks. So it's a very effective way of working with agoraphobia. I do encourage you to think about this more, and to please contact me if you're really serious about getting over your agoraphobia. Thank you.